Hi, my name is Susan Farnsworth. I am a student at the University of Memphis. Today is January 23rd, 2025. And this is my head-to-toe assessment. I'm going to scan the room. Let's see, look that way, my Snellen chart, my bench and bed, all my supplies, and back to where my phone is going to go. Oh, and the ceiling. Okay, we're going to start each part of the assessment by assessing overall skin. So I'm looking at color, temperature, turgor, moisture, edema, bruises, nevi, lesions, but we'll start with the head. So we look at the size and the shape and symmetry. Then I would palpate the head looking for any nodules, masses, lesions. I'd note the color of the hair, the distribution of the hair, and look for any infestations. Then we move to the lymph nodes. So I'm going to palpate each of the lymph nodes. So we'll start with preauricular. We'll turn just a little bit. Preauricular, postauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Then I'm also going to palpate her temporal arteries for any pain or tenderness, any pain. No. Then we'll assess cranial nerve number 5. So I'm just going to I'm going to feel your masseter muscle while you clench your jaw. So just squeeze your jaw, and that's good. And then I'm going to do sensation. So close your eyes and tell me where I'm touching you.
Cheek. Oh, sorry.
Nope, you're good.
Nose. Chin.
Okay. Then we'll move on to the eyes. We'll start by doing assessing cranial nerve number 2, which is with my Snellen chart over there on the wall. So cover one of your eyes and read the bottom line.
O T F P H.
Okay, now switch.
L T F P H.
Okay, now read it backwards with both eyes.
H P F T L.
Great. Now I'm going to assess cranial nerve number 3 by, I'm going to look at, I'm also going to assess peripheral vision. So I think I'm going to go from behind you, and you just, on the left, you tell me when you see my hand.
Okay.
And I'm going to go on the right and tell me when you see my hand.
I can see it.
Okay. So 90 degrees. Then we'll do cranial nerve number 3, which is to test for conjugate gaze or pupillary reflex. Sorry, pupillary reflex. So I'm just gonna look across the room. I'm just gonna look at your, turn this the wrong way. Okay, good. I'm also gonna test conjugate gaze and convergence. Not conjugate gaze, that goes with extraocular muscles, but look at my nose and then watch my finger as it gets, so look at my finger and watch it as it gets closer to you. Okay, good. I was supposed to do ears first. That's okay. We'll keep going with eyes. I'm also going to look for the red reflex and at the internal structures of her eyes. So good, red reflex. That's good. Since I skipped ears, we're going to go back to ears. First, I'm going to notice, again, look at the symmetry and the size. I'm going to palpate both the pinna and the tragus for any masses or nodules. I'm going to inspect the tympanic membranes with my otoscope. That one's pearly gray. And that one's also pearly gray. We're going to do test cranial nerve number 8, which is 3 separate hearing tests. The first is going to be the whisper test. So I'm going to stand right here behind you and cover this ear, and I'm going to whisper 3 things, and you just repeat it.
Okay.
1, 2, 3.
1, 2, 3.
Okay, now switch sides. A, B, C.
A, B, C.
Okay, good. Then we're going to do the Weber test. So I have my tuning fork. I'm going to activate my tuning fork, maybe. And do you feel it symmetrically down both sides, or hear it symmetrically?
Yeah.
Good. Okay, now I'm going to do the Renee's test. So again, I'm going to activate my tuning fork. I'm going to place it on your mastoid bone. Tell me when you're no longer hearing it.
Okay. I can't hear it.
Can you hear it still?
Yeah.
Okay, tell me when you can't hear it anymore.
I can't hear it anymore.
Okay, so air conduction is greater than bone conduction, so that's good, and I would repeat that on both sides. Now we're going to move on to the nose. So again, looking at symmetry, I'm going to assess for nasal patency. So I'm going to have you close your eyes and close one of your nostrils.
My eyes and one.
Mm-hmm. And can you smell that? Sorry. What is it?
Alcohol.
Okay, no. Look the other side. And smell. And what is that?
Essential oil.
Okay. So nares are patent. I'm also going to palpate the maxillary and frontal sinuses. Nose, throat. Then we'll move on to the mouth and throat. And looking at her mouth, I would look at her lips, her gums, teeth, buccal mucosa, salivary ducts. So open your mouth wide for me. Her tongue, under her tongue, good. All of her teeth look good. I'd also note tonsils and grade of tonsils, but she doesn't have any tonsils. I'm trying to think. Then I'm going to assess cranial nerves 9 and 10. So you can just open your mouth, say ah, and her soft palate rises with phonation. Let's see. And cranial nerve number 12, so stick out your tongue. And it's midline with no fasciculation, so that's good. Next, I'm going to look at her neck. Again, assessing the skin for the color, the moisture, temperature, turgor, any bruises, lesions, masses, edema, any changes there. I'm going to palpate her trachea, and it's midline. Then I'm going to assess her thyroid gland. So, can you swallow for me? Okay, good. And then I'm going to move on to, trying to think if I forgot anything, I'm going to move on to posterior chest. So go ahead and turn around for me. I'm going to start by just assessing the skin of her posterior chest, so color, temperature, moisture, turgor, masses, lesions, nevi, anything like that. I'm going to note if there's any difficulty breathing, so retractions, tripod sitting, nasal flaring, anything like that. But I'm going to palpate for symmetrical chest expansion, so take a deep breath for me. Okay, that's good. And then I'm going to, sorry, let me turn you a little bit, assess for tactile fremitus. So every time, so I'm going to touch you like this, and every time I move my hands, you just say 99. So,
okay. 99, 99, 99, 99.
Good. Then I'm going to percuss in each, in the different intercostal spaces, so. And now I'm going to listen to her lung sounds. Take a big deep breath. Okay. Now we go all the way down, back and forth, and make sure to get the lateral lobes, but especially on the right. Then I would also assess for egophony. So every time I move my stethoscope on your back, you just say E.
Okay.
So
E, 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 E.
okay, now every time I move my stethoscope, say 99, and this is assessing bronchophony.
99, 99, 99, 99, 99, 99.
Okay, and then the last one is whisper petriloquy. And so I want you to whisper 1, 2, 3 every time I move my stethoscope.
Okay. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
Okay, good. Now I'm gonna have you turn back around. And I'm going to assess the anterior chest, again looking at the skin, color, temperature, turgor, moisture, lesions, nevi, bruising, edema. There's nothing there. I'm going to, again, look at chest expansion, so take a deep breath for me, and that's good. And I'm going to assess for tactile fremitus again, so same thing each time I move my hands, just say 99.
99, 99, 99, 99.
Okay. Now I'm going to auscultate her breath sounds in the front. So I just go back and forth, all the way down her chest, and making sure to listen to the lateral lobes. Okay, so now we're going to do the assessment of the heart. I'm going to start with auscultation in each of the 5 areas, so I'll list those. I do not have a bell, so I would listen with diaphragm first, so aortic, and pulmonic, and Erb's point, and tricuspid, and mitral. And again, I would repeat that with the bell of my stethoscope, but I don't have a bell. I would also listen for the PMI, that's by the mitral valve. And for the sake of time, I'm not going to do that, but that would be listened to for a full minute and recorded. Okay, now I need you to lay down. So I'm gonna move this back and we'll move that over. So maybe go sideways. That way. Okay. So I'm going to have her lay down at a 30 to 45 degree angle so that I can assess for jugular venous distension. So I would note that on the neck, and there's no sign of it. I would again auscultate her heart sounds in the same location, so aortic and pulmonic and Erb's point, tricuspid, and mitral. And again, I would do that with the bell. Then I would move on to the abdomen, noting the size and the contour and the shape, and again, noting any issues with the skin of the abdomen. I would start with auscultation, listening to the bowel sounds in each of the 4 quadrants. And then I would percuss in each of the four quadrants. And then I would palpate in each of the 4 quadrants for any masses or tenderness. Then I would palpate for the spleen in the left upper quadrant. So, sorry, I push super hard. I can't feel the spleen, that's normal. And then over on the right hand side to percuss the liver, and I can feel the liver edge. I would also listen for any bruits of the aorta, the renal arteries, the iliac arteries, and the femoral arteries. Okay, good. And when I go back to heart, I would also palpate in each of the areas that I percuss to also look for or feel for any thrills in those locations. So it'd be aortic, pulmonic, tricuspid, or Erb's point, tricuspid, and mitral. So go ahead and sit up for me and face towards me for just a second. And I'd also assess for costovertebral angle tenderness. So does that hurt? Does that hurt? Okay. So we can move this back and then use the stool again. So you can face the camera. So we're going to move on to musculoskeletal. So first I'm going to, again, note the skin of both the upper and the lower extremities, any color changes, edema, bruising, swelling, lesions, nevi, just anything of note. And then I would start by assessing capillary refill, each of her fingers, and then feeling for radial pulses. Good. Then I would palpate each of the joints, so the finger joints, the wrists, the elbows, the shoulders for any crepitus, masses, lesions. Then we'll do flexion or range of motion of the fingers. So flex, and extend, and hyperextend, and abduct out and adduct in. Good. And then we'll do wrists. So flex, extend, hyperextend. Sorry, told you that too soon. Radial deviation, so in, ulnar deviation out, and then rotation. Good. And then elbows, we'll flex and extend and hyperextend. Good. And then shoulders, we will flex, so up, extend would be down, hyperextend would be back. Internal rotation, there you go, and external rotation, good. And circumduction, good. And then also abduction would be out, and adduction would be in. And then I'm going to assess strength of the hand, so squeeze my fingers. So that's good, 5 out of 5 strength. And then I'm going to assess bicep strength, so I'm going to pull your arms. Don't let me pull. Good. And then I'm going to push. So biceps and triceps. And then I'm going to hold your shoulders and you push against. Good. And then same, push in. Good. And then the final cranial nerve is cranial nerve 11, which is with shoulder shrug. So go ahead and shrug your shoulders against resistance. Good. With that, I'm also going to do light touch sensation. So go ahead and close your eyes, and it might be a little bit hard with your long sleeve shirt, but I'll try. Tell me where I'm touching you.
Hand, forearm,
my arm. Okay. Okay. Also with this, I want to do, I want to test graphesthesia and stereognosis. And with stereognosis, I'm going to hand you an item. So close your eyes. I'm going to put it in your hand and you tell me what it is.
Paperclip.
Okay. Now keep your eyes closed. Let me hand you something else. The other hand. And tell me what it is.
A rubber band.
Okay. And then I'm going to write a letter in your hand and you tell me the letter I write.
G.
Okay. I don't know, do it again.
E.
Or I'll do an easier one.
Oh.
Okay, good job. And I want to test cerebellar coordination. So I want to do serial finger opposition. So with both hands. Good, good. And then flip flop on your good. And then touch your nose and touch my finger. And touch your nose, touch my finger, touch your nose, and touch my finger. Good job. Okay. I think that was everything for upper, so we're going to move to lower extremities. Again, looking at color, temperature, turgor of the skin, moisture, edema, especially in the lower legs, lesions, nevi. Can we see your feet on here? I don't know. Stand up for a second. Let me move you back. Okay. So I'm going to assess again capillary refill of her feet and then dorsalis pedis pulses and let's see, I'm going to take your other sock. Okay. Refill, dorsalis pedis, and then not remembering what that's called right now. Again, I'm going to palpate each of her joints, so toes, ankles, knees, hips for any masses, lesions, tenderness. And then I'm going to test strength, so push up on my hands, push down on my hands, good. Don't let me push your knees back. Now pull my hands back, good. And then push your legs apart, pull your legs together, good. And before I have you stand, let's do all of your deep tendon reflexes. So I have my reflex hammer. First we're gonna do, just go ahead and rest it there, brachioradialis. I'm gonna do it bilaterally, good. And then, let's see, how do I do this? Let's go ahead and relax your arm, brachial, and sorry, I can't use my words. Go ahead and relax your arm and your triceps. Good. Now we do that bilaterally. I'd also check patellar. Can't see where your knee is. Good, good. And then Achilles. Good. Good. And Babinski. Good. Okay, now I'm gonna have you stand. Move this out of the way and back up just a little bit. While we do the flexion and extension of your toes, you might have to lift your foot up. So flex your toes, extend your toes, hyperextend your toes. Can you abduct, like out and in, abduct? Good. Now let's do ankles. So flex your ankles, so up. And then extend, which is normal, and hyperextend, and then, well, dorsiflexion's up. Sorry. And then external rotation, internal rotation, and then good job. And then we'll do knees. So flex your knees, extend, hyperextend, good. And your hips would be flexion, extension would be just standing, hyperextension, and then abduction. Adduction would be in, and then internal rotation and external rotation. Good. And you do that on both sides. Now I'm going to assess her back. So bend over. I'd assess her spine. For any scoliosis, any curvatures, and also any masses or lesions. This also shows flexion of her spine. So go ahead and stand up. That would be extension. You can turn back around. Hyperextension would be leaning back. Good. lateral rotation, and then that's good. Let's do the same with your neck. So flexion, extension, hyperextension, and then lateral flexion, both sides, and then turn, and turn. Good job. Okay, now I'm going to assess Romberg. So again, for the sake of time, I'm not going to do that for full 30 seconds, but she would close her eyes and just stand without any swaying or any movements. Then I want you to walk towards the camera, just normal gait. Okay, now when you turn around and come back to heel to toe. Like put your feet together, sorry.
Oh.
Like heel to toe like this.
Oh.
Yep. Good job. And then hop on one leg. And then hop on the other leg. And I think the only things that I forgot was light touch sensation on her lower extremities, which I guess close your eyes for a second and I'll do it and tell me where I'm touching you.
I like toes, thigh.
Okay. And I believe that completes my head to toe assessment.